Good morning, good afternoon, and welcome. My name is Dr. Taylor, and we're going to be doing something very special, giving some educational lectures about cannabis. The title of this lecture today is, What is Your Grandmother Doing? What is your grandma doing? What is your grandmother doing? We're actually going to be reviewing an article entitled Cannabis, an Emerging Treatment for Common Symptoms in Older Adults. This was presented and published in the Journal of American Geriatric Society recently in 2021. Who am I talking to? Who are we talking to? I'm talking to women, baby boomers, 55 to 70. You may be suffering from pain, anxiety, insomnia, or depression. I'm also talking about the people who revolve around you, and that may be your children, your grandkids who support you, and you may support also, in addition to the healthcare team that provides you with medical care. We're going to start with an invocation, and since it's the first in our series, we're going to start with Imhotep. Imhotep, as you know, was a scientist, a scribe, a philosopher, an astronomer, a mathematician, an architect, historian, and yes, he was a physician also. And Sir William Osler said, the first figure of a physician to stand out clearly in the midst of antiquity. I always want to start with our famous saying, do not leave your physical activity, nutrition, and mental health to chance. All right, let's get started. Let's get started with a case. We have a 71-year-old retired woman who presents for her annual wellness evaluation with her primary care physician. She is accompanied by her adult daughter, who is an executive at an aerospace company. She has a laundry list of issues to discuss, including her migraines, her low libido, glaucoma, sleeping issues, anxiety, depression, and of course, her painful arthritis. She's active in church, in her Rotary Club, and walks 30 minutes daily. Her medications include riboflavin 400 milligrams, magnesium 500 milligrams, coenzyme Q10, and cannabidiol tincture 20 milligrams sublingually twice a day. Here's the question. What is she most likely taking the cannabidiol tincture for which of her medical issues? A, migraines, memory, C, glaucoma, anxiety, or arthritis. All right, let's start with an introduction to cannabis. Cannabis has been around 5,000, maybe 10,000 years ago, described in multiple ancient texts, including the Chinese texts and also some of the Indian literature. There has been a recent reinterest, an unprecedented reinterest in the United States and Canada about the potential of the positive health effects of cannabis. In America, there are different programs in different states. Right now, in about 33 states, CBD and tetrahydrocannabidiol are allowed. There are some states, about 13, which only allow CBD promote products only, and about 4 states have no program in place. 11 of our states have legalized, recreational cannabis by use by adults. In 1969, only 12% of Americans supported cannabis legalization. That is in contrast now, in 2019, 67%. There was a recent passage of the Farm Bill in 2018, 2019, in which hemp was legalized, and hemp-derived cannabidiol products are now more available worldwide, which urges in increased access for patients, people like you. And again, more and more data is coming out, about the benefits of cannabis for some chronic medical conditions. And this is included in data from the National Academies of Science, Engineering, and Medicine in 2017. Now let's do a double intro number 2 to the state of aging. One of the fundamental factors or forces acting on healthcare. The data shows that Americans ages 65 and older, that population is projected to double, from 52 million in 2018 to 95 million by 2026, by 2060 that is, 2060. All right, and the 65 and older age range, the group that share the total population, will rise 16% to 23%. All right, it is also expected that the group 80 plus will increase 9.3 million in 2000 to 19.5 in 2030. It doesn't matter where you go, folks. Worldwide, in Europe, North America, and Asia, the aging population is doubling. Okay, there has been some studies, epidemiological studies done by Hahn and Palmer. Of course, we'll have these references available for you, that the cannabis use by those 65 and older in the United States has increased sharply. All right, from 0.4% in 2006 and 2007 to 2.9% in 2015 and 2016. You also have an additional 2.4% increase in 2015 to 4.2% in 2018. And that's amongst those 65 and older. That looks like a relative increase, folks, of about 250%, okay, from 2006, 2007 to 2012 for those using cannabis and cannabis products 65 and older, 250%. There are some studies, excuse me, that were also in the article that I have right here, done at the University of Colorado. They surveyed 2 geriatric clinics, 345 people. 32% of those folks were found to at least use cannabis once. The majority of those were ages 70 to 79. 25% were 85 plus, and the majority of those were white women. Common reasons for those were pain and sleep disorders. There was another University of Colorado project done amongst community dwelling adults 60 and over, and they were found to report using cannabis for both recreational and medical purposes, and overall they generally thought it had a positive impact in their life. This is also found in the Florida Medical Marijuana Registry. Half of those people are older adults, and the most common reason for using cannabis was chronic pain. Key terms. All right, so cannabis, let's start with that one. So, it is a complex botanical product, okay? Different compounds created and stored within the plant that has different effects on the human body. There are compounds called cannabinoids, all right, that would include THC, which we'll go into a little later. Also other cannabinoids such as CBD, CBG, CBC. Also items such as terpenes, all right, that's responsible for the plant's aroma, flavonoids, which we think play a role in the plant's protection from UV light and sunlight, and there are approximately 120 cannabinoids. Another key term, hemp. This, folks, is cannabis that contains less than 0.3 THC. The THC is a component, again, that is known for its psychoactive effects. Marijuana. Marijuana is cannabis that contains greater than 0.3% THC by dry weight. The Farm Bill. The Farm Bill, folks, legalized hemp for transfer across state lines, sale and transport, and possession. Key term to know. Cannabinoids, again, one class of compounds found in the cannabis plant. THC, delta-9 tetrahydrocannabinol, again, responsible for its psychoactive effects. Cannabidiol, no psychoactive properties, receptors in the immune system, also in other major systems in the body to include cardiovascular and endocrine system. All right, so let's dive into this article and start with its methods, okay? The first part of the methods include the survey development and the timing of administration. All right, this again was an anonymous survey of patients seen at a geriatrics clinic at the University of San Diego in California. They based this on 2 other surveys with feedback from the clinicians and other cannabis experts. They did a test run in June 19th to June 24th, 2019, that included about 84 patients. The final version was administered between June 28th, September 6th, 2019, and the idea was to be that the survey would be completed in less than 10 minutes. All right. They collected demographic data to include age, race, ethnicity, sex, marital status, education level, and cannabis use. Other questions to include if you answered yes to what ages, if you answered yes to using cannabis, and they also went on to ask what age from whom the source of acquisition, the frequency, others who may be aware of negative effects, conditions for use, and the helpfulness of cannabis. What else did they want to find out, ladies and gentlemen, in particular ladies, is data collection procedures. They also talked about the participants and data analysis. So how did they collect this data? The survey was provided by the staff when the patients checked in for a visit. All right, they told them it was anonymous and also voluntary. People completed it in the reception area before going into the exam room, and all the results were placed in a locked box. The patients were asked to return the survey even if they didn't complete it, and this survey was indeed exempt from the UCSD IRB board, which stands for Institutional Review Board. Folks, these are the people who make sure it's safe to do these surveys with people and their data. The participants, extremely important. 601 surveys were distributed, 568 were completed with a return rate of 95%. 73% were 75 and older, 57% were female, 79% were non-Hispanic white, 53% were married in a long-term relationship, and 85% at a minimum had some college. Data analysis, the data was analyzed in 3 stages, okay? The first stage was focused on those who used cannabis in the past 3 years, and they compared that with the demographic characteristics between those who've used it in the past 6 months versus those who've used it between 3 years and 6 months ago, all right? The second group compared these groups for items such as cannabis use, reported side effects, and reasons for use. And third, to explore lifetime patterns, they identified cannabis users who reported using cannabis for the first time as older adults, compared this group with those who had previously used cannabis. For you statisticians out there, was a T-squared or Fisher test, exact test when appropriate. The results. Okay, so I've got my handy article out right here. So there's a couple of things. There are a couple of tables and a figure. So table one, and we'll flash on the screen for you following along at home, talks about the demographic characteristics of the cannabis users. Okay, different characteristics. Some highlights, including 79% of those who responded were between 65 and 84 years of age. 60% were women. Okay. 92% were white, 89% had some sort of secondary education. Okay, table 2. Okay, table 2 talks about the cannabis use characteristics of those who used cannabis within the past 3 years. Okay, in the past 3 years. So what do we see here? What are some highlights from this table? Table 2. 40% used CBD only. Okay, 80% reported using it for medical reasons only, as opposed to recreational, 80%. Okay, the most common method by far was lotions, secondary, followed by tinctures. 37% that is, reported using more than one method. Half received it from a dispensary, and oddly enough, the healthcare provider was only involved in less than 40% of the time. So 40% of the time, you doctors out there, you PAs, you nurse practitioners, all of you all who interface nurses with the person, you're only involved in about 40% of the time. There's some room to improve. Okay, let's keep going. Results 2. We have a figure, okay, and another table, table 3 and figure 1. Figure 1 right here, again, we'll let you see that. And what this talks about is the reasons for cannabis use amongst all users. Okay, the reasons for cannabis use amongst all users. The most common found in this survey, folks, was pain/arthritis at a whopping 73%. 73%. Followed by sleep disturbances at 29%, anxiety at 24%. Okay? Pain, sleep, anxiety, which you can't see on the graph, but embedded into the document here, talks about 3/4 of the patients deemed cannabis somewhat or extremely helpful in managing any of the conditions tested for. Okay? 40% used it for more than one symptom. Okay, 24% used it for arthritis and sleep, 9% depression and anxiety, and about the same for pain/arthritis, sleep, depression, and anxiety. With most common side effects being dizziness at 15%, which is not to be taken lightly, especially among baby boomers and aging population. Anxiety followed by anxiety, dry mouth, and paranoia. All right, last table. This table, table number 3, talks about and describes cannabis use characteristics, comparing those who use cannabis for the first time as older adults versus who use cannabis earlier in life. Out of the 82 people who responded to this question, 61%, okay, 61% use it for the first time as an adult, 61 years and older. Okay, 61%, okay. Those who use it for the first time are more likely to be older, use CBD-only products, use it for medical purposes, again, lotion followed by tincture, and more likely to report this to the healthcare provider, their use, okay, and less likely to consume cannabis via smoking or edibles. All of these were statistically significant. Okay, so we're riding on home right now. Discussion. Let's discuss this. You know, as in every article and every survey, there's some limitations. Okay, you know, this again was a small sample size. Okay, small sample size, less than 600 people. Okay, it was done in San Diego, California, which arguably does not represent a lot of other people. Right? California, cannabis is legal. Okay, this was done at an academic medical center. Many people don't have access or not serviced by an academic medical center and the things that may offer. This population was perhaps more affluent, okay, more highly educated perhaps in other parts of our nation. Okay, we're also dealing with a West Coast versus a South versus the East, North, and Central United States. Topic sensitivity was also an issue, a drawback. Are people willing to discuss their use of cannabis, whether or not the survey appeared to be anonymous or not? And of course, there's a language issue. This survey was only conducted for those who spoke English, and as you know, this is an international time for not only the United States but the globe. This is a international environment. So, what is your grandmother doing? Okay, what is your grandma up to? Okay, all right, so look, the odds are if she's a baby boomer or older, okay, baby boomer or older with some type of chronic pain, anxiety, depression, or insomnia, she may have some friends who have heard of, okay? She may be seeking information about, considering, or already using cannabis in some form for relief, okay? The aging population is doubling. Common health conditions are common and are growing in that group also. People want relief. There's a changing legal and social landscape, and past life experiences all make it easier. Vietnam War, civil rights, reefer madness, 1934, all those things are changing people's viewpoints about cannabis and their health. Now, in terms of older people, older population, there are increased risks for side effects, polypharmacy. Thus, if you're concerning it, you need a personalized approach. It would be also fantastic if we can reduce the risk of opiates and benzodiazepines in that age group. And if cannabis can be used safely within reason, then that would be a value add. All right? And this highlights, again, the role of the family, the adult children, the grandkids who revolve around these older adults who are seeking relief. The importance for them to be educated so that they can make sure educated decisions and safety can be brought to the forefront. This also brings up the importance of the healthcare team. The literature supports the integration of scientifically sound information about cannabis into medical education, ongoing professional education, even going as far as asking questions on the medication reconciliation for your patients. Healthcare providers need to be in the know. All right, let's finish up with our case review. Again, we talked about the 74-year-old woman who presented for her wellness evaluation with her adult daughter in the aerospace industry with a laundry list of issues, okay? She's active. She's taken a couple of medications and she has some cannabidiol CBD tincture, 20 milligrams. She has most likely taken cannabidiol tincture for which of her medical issues? Is it her migraines, her memory, glaucoma, anxiety, or arthritis? Well, we know from the article that the most common reason, 73%, is arthritis. she's most likely taking it for that. Okay? So, in conclusion, again, my name is Dr. Taylor. What is our call to action? What is my call to action? Ladies, if you're in the baby boomer population, I'm sure some of you all have a chronic condition, such as pain, such as anxiety, such as depression, such as insomnia. Is there a role for you? I encourage you to ask your friends. I encourage you to speak with your healthcare provider, your healthcare team about the potential for cannabis. Is it for you or is it not? All right? You can visit us at www.medibles.io to learn more and fill out an online assessment. Thank you and have a great day.